Together we achieve victory over heart failure.
Hi, this is Dr. Arvind from Max Hospital in Gurgaon. Today we delve into a critical aspect of healthcare, monitoring heart failure conditions. It is very difficult to notice heart failure right away. As our heart faces increasing strain, it compensates by working harder. Yet, as heart failure progresses, its ability to pump blood diminishes gradually. And over time, the subtle changes may go unnoticed, emphasizing the importance of recognizing heart failure symptoms. Now, what are the symptoms of heart failure? Swelling in the feet, ankles, or abdomen, along with sudden weight gain, these are common signs of heart failure. So, monitoring your weight on a daily basis can also help in managing the swelling. Shortness of breath during daily activities, and interruption in breathing due to persistent coughing or wheezing warrants medical attention. Difficulty in sleeping may also indicate heart issues. People complain that they feel better when they sit up and very breathless when they lie down. Now, this is a symptom of heart failure. Fatigue, confusion, or fainting may signal inadequate blood flow to the brain. Other symptoms like rapid heart rate, nausea, or lack of appetite could also indicate heart problems. If you notice any of these symptoms, swelling over feet, difficulty in lying down, breathlessness, or fatigue, it is always a good thing to seek prompt medical care. Now, let us also discuss about key heart numbers. What is the blood pressure? What is the pulse? What should be your cholesterol like? Where blood pressure is concerned, the normal value of blood pressure is 120 by 80. But there's nothing called a normal value. It has to be a range. So we say that the upper blood pressure, which is also called the systolic blood pressure, should range from 120 to 130 or up to 140. Whereas the lower value should not go beyond 90. However, it is always the best idea to keep your blood pressure between 120 by 80. The next crucial number is what should be your cholesterol levels like. Now we know there's something called a good cholesterol, which is the high density lipoprotein HDL, and something called the bad cholesterol, which is the LDL. In general, you should try and keep your LDL below 100. And if you are a diabetic, much lower, less than 75. Or if have a heart disease, then also less than 75. But in general, try to keep your LDL values less than 100. A good HDL is the good cholesterol, and it will be a good idea to maintain the HDL values above 45. Let's also talk at the same time about heart rate or pulse. Heart rate is the number of times your heart beats per minute, and it is actually the same thing as pulse. Your resting heart rate is the lowest rate when your heart beats when you're not exercising. So if you're checking your heart rate when you've just come after a walk, it will tend to be a little higher. So it is best to check the resting heart rate. And typically, this should be kept between 60 to 100 beats per minute when you're calm, relaxed, and not ill. For moderate exercise, and especially if the exercise is unmonitored, do not take your heart rate more than 85% of your maximum heart rate. And the maximum heart rate is calculated by 220 minus your age. So suppose you are a 60-year-old person, 220 minus your age is 160. Take it to 85% of 160 if you're unmonitored. There are many wearable activity trackers that are available that can monitor your heart rate during exercise and throughout the day, helping you keep tabs on your cardiovascular health. So this concludes today's discussion on monitoring heart failure conditions. Do take care of your health, and thank you very much.